Alrighty. Hello, everyone, and welcome. Thank you for tuning in. So, we are here today to introduce our brand new Associate Medical Director, Dr. Sasha Kaiser. Dr. Kaiser, thank you for joining us today. How are you doing?
I'm doing well. Thank you for having me.
Great. So I will be asking Dr. Kaiser some questions throughout this stream, but if you have any of your own questions for her, please go ahead and pop those in the comment section on either Facebook or YouTube, whichever platform you are watching on. We'll see those and we will ask them. And if it's after the stream, you are still welcome to comment and we will ask Dr. Kaiser offline. Alrighty, let's go ahead and get started. So, tell us a bit about your journey here. What is your background? What led you to this role?
You could almost ask what is not my background, because there's been a lot of things that have led me down here. I actually started out as a pharmacy technician when I was in undergrad. And so during that time, I had a lot of exposure to the different pharmacology and different drugs that patients were receiving as an outpatient. I went to nursing school and actually worked as a nurse for a couple of years before deciding that I wanted to go back. And I went to medical school, and then I ended up pursuing emergency medicine training. And during that time period, you're exposed to a lot of different things. One of the fun things about being in the emergency room is you never know what's going to happen or what's going to show up. And part of that is exposures to overdoses, to snake bites, to envenomations. And so it started to really pique an interest in kind of all of these other things. And then I had the opportunity to do some training regarding toxicology, regarding the study of poisoning and exposures during that time period, and really enjoyed it. And so went on to pursue further training for toxicology, which again is kind of the study of poisonings and exposures environmentally, and did that training at Rocky Mountain Poison and Drug Safety in Denver, Colorado, and then came out here.
So, you have seen a lot of different facets of toxicology then.
Yeah, it's been a great exposure to multiple different layers. You have it on the different parts of kind of what the patient is experiencing. I've been able to interact with patients at different levels and to really see it on different points too, from retail pharmacy to in the hospital to at the poison center.
Great. So, can you tell us what some of your new responsibilities are as our Associate Medical Director?
Yes. So transitioning to this role, you have a little bit more of a role in the public health standpoint. So before, when I was in some of my training for this, you are working with the patients after they've already had the exposure. From the poison center standpoint, not only do you get that part of it, but you get the outreach, you get the population level, because we are starting to see the trends oftentimes before individual sites are. And so you can start to see, hey, for instance, the fentanyl exposures that we've had a lot of. The poison centers were some of the first ones to really recognize those trends. So you get to be there for the public health part of this from both a prevention standpoint as well as how do we manage this on a population level. And that's kind of the fun part about this. You don't only get to take care of the individual, you get to take care of the community, which is a huge part of the reason why you go into medicine in the first place.
So, last year we introduced Dr. Phillips, who is our medical director and now also our executive director. And we asked him about how COVID has affected our call volume. And he talked a lot about hand sanitizer, cleaner exposures, all of those things that we were getting a lot of those calls at the start of the pandemic. Well, now we are much further in, but COVID is still changing what we're seeing. So, can you speak a little bit to how COVID has changed the poison center world, how it's changed toxicology?
Absolutely. So one of the things that as community that we've really struggled with this is the mental health aspect. Because of that, we really weren't able to have the same types of connections with people, and we've seen a huge increase in how that has impacted our patients. We've seen a huge surge with our adolescent mental health concerns. And so I think we had talked about that a little bit in June of 2022 with the Poison Center here. And we've also had limitations with people getting access to their therapist or getting access to their mental health providers. And so part of the ramifications of that are we seeing more overdoses. So I think that that's one thing that has really impacted this, especially in the very beginning when there wasn't as much ability to do a lot of the outreach as we were still trying to figure out how to manage COVID itself. Luckily, we're not seeing as much of the hand sanitizer and cleaner exposures. But I think a lot of this is kind of managing where we are as a nation with our mental health. And when people get really depressed, we tend to see more overdoses.
Yeah, especially in our teen populations too.
Yes, this is a very vulnerable population. It's really hard to be a teen in general. And then you throw on COVID on top of that. And I think that makes it hard. And especially too, when you don't have access to the providers like you used to in the past, it just can be very, very difficult. Luckily, the state has done a lot of things with establishing new crisis lines and trying to make sure that we have those interactions. But if anything happens, the Poison Center is always here to help kind of field those questions, field those calls, and provide some information.
Definitely. And if folks are interested in learning a little bit more about Poison Center trends that we're seeing related to mental health, to overdose, we do have our upcoming series. It's our third annual overdose prevention, harm reduction, and treatment series. It starts on Monday. We can pop a link into the comment section for the landing page to that. So we encourage folks to register for Zoom sessions, to attend the live streams, and we'll dive a lot more into those issues. So shifting a little bit here, what is some of your most interesting or challenging cases that you've come across?
Well, there is a cobalt blue tarantula. So if you guys have never seen this, I recommend you Google it because it's beautiful. And I hate spiders, but it's beautiful. But it actually bit its owner. And there's not a lot of literature about what happens when a tarantula bites you. And so he had pretty significant pain. It's not the same type of poisoning, but then it's kind of how you manage those symptoms based on what we know about the venom. So that was a really interesting one because whoever has this happen. But again, this is kind of the fun part about toxicology. You can go from one phone call where it is a tarantula bite to another phone call where it's this weird metal exposure to another phone call where you have somebody who decided to make some plants into a stew and got really sick. So I think every case is really interesting. And every time that you think you know a substance really well, you get a different way that's an exposure to it.
Never a dull moment in the Poison Center world.
No, there's always learning, which I think is one of the reasons why a lot of people go into this is because you get a nerd out a little bit. And with each time you learn something new and you're like, I had no idea this could happen. How interesting. Let's talk about this a little more.
All right, last question for you. Are there any other important messages that you would like our viewers to take away today?
I think just remembering that we are always here. This is a free service. You won't get a bill for calling us. And so if you have questions about your medications, if you have questions because you accidentally took an extra dose or you're worried about these interactions, we are here for the public. We are here when patients get admitted to the hospital. We're here to kind of help those guidance as well too. And so our phone number, as you see, is kind of on the bottom of the line. And if you have questions, we're here 24/7. Give us a call.
Excellent. Thank you so much, Dr. Kaiser, for taking time out of what I know is an incredibly busy schedule. We've loved having you sit down with us, getting to know you a little bit better. And folks who are watching, please, you're welcome to still ask any questions. We can pass them along to Dr. Kaiser afterwards and get those answers for you. I think that is everything that we have today. So thank you again, Dr. Kaiser. Thanks everyone for watching, and we will hopefully see you all next week as we start our overdose series.
Thank you so much.